Hello, hello, hello. Welcome back to a new year and another exciting episode here on Doctors Go Live with me, your host, Nina Sharil Khan. And today we are talking about heart attack, not just chest pains. Now, let us know who is tuning in, where you are tuning in from, and do share with us. It is a new year, new you, so new health goals. What are your health goals for 2024? And of course, what are some important questions that you have for today's episode of Heart Attack, Not Just Chest Pains? All right, so let us know in the comment section. And of course, if you share this video out, you get to take part in our Doctors Go Live quiz, which is happening right at the end of the Q&A, where we've got exciting prizes for you to win. All right. Now, of course, all this is happening right here in Doctors Go Live with me, Nina, and your special guest for today, consultant internal medicine physician and interventional cardiologist from Columbia Asia Hospital, Tebrau, Dato Dr. Abdul Hadi Jaafar. Now, also, why are we kicking off this year, 2024, with this topic? Because for the past 30 years, deaths from cardiovascular disease surged a whopping 60% globally, and yet nearly half of the people who have a heart attack don't even know they have one at the time. So today we're looking into beyond heart awareness, and we're going to provide you with all the actionable insights and how to identify signs, understand symptoms, and know exactly what to do when you're faced with a heart attack. So if you know of someone who this info will be very useful, it could save their life, please tag them, share this video out on all your social media, and follow us, because you never know, it could change somebody's life. All right. Now, while you're sharing the video, please take a look at this video.
Here is a surprising fact. Nearly half of those who suffer a heart attack don't realize it at the time. Recognizing these silent warnings is very crucial, as they hold the key to saving life. I, Dr. Abdul Hadi Jaafar, consultant interventional cardiologist from Columbia Asia Hospital, Tebrau. In the next episode of Dr. Go Live, will dive into the world of cardiac health and equip you with the knowledge to identify the signs, understand the symptoms, and know exactly what to do when faced with a heart attack.
Welcome back to Doctors Go Live. Today, if you've just joined us, we are zooming into heart attacks, because they are not just chest pains. All right. Now, believe it or not, nearly half of the people who have a heart attack don't even know they're having one at the time. So recognizing the silent warnings is really crucial. It is the key to saving lives. And here to help shed some light on this very important topic, please welcome consultant internal medicine physician and interventional cardiologist from Columbia Asia Hospital, Tebrau, Dato Dr. Abdul Hadi Jaafar.
Hi. Sorry.
That's all right. Thank you so much for joining us. We're really excited to learn more about this, so that we can equip ourselves and not be one of the highest statistics for the past 30 years. Before we begin, though, Doc, just information for our audience. Right at the end of the show, we have our Doctors Go Live quiz, where today we've got some really exciting prizes up for grabs. But most importantly, you want to pay attention to Doc, because he has the key to all the answers of the quiz questions. All right. And of course, if you have any questions, just type away in the comment. We'll get to answer those questions right at the end, after we go through the slides. Right. All right. So shall we get into it, Doc? Before we begin here, Doc, could you share a little bit about yourself, what you do, and how did you get started in cardiology? Why cardiology?
Actually, I started in cardiology because actually I'm from Pahang. At that time, very few cardiologists from Pahang. Then they want me to establish a center, cardiac center in Pahang. Then because of that, I voluntarily say yes, I'm the one, probably maybe the chosen one to go for the further training of cardiology. I started my training in Penang, GH. Then has some experience in Germany. That I love to do primary PCI. This is emergency procedure. So when I opened cardiac center in Kuantan, that went way back in 2008. So 100% actually at that time, I did my primary PCI. Primary means I open immediately on the spot, just after the chest pain. This is very important for the life-saving, internal quality of life. We reduce basically the incident of heart failure. Then after
Okay.
that, I took optional retirement. I joined UIA as a lecturer. Then
I
I'm already
see.
retired now actually. Then now I joined Columbia Asia Tebrau. Yeah. A bit
Sakina,
of yeah.
so Sakina is saying bukan calang doktor ni very senior. Yes, indeed. You actually started the cardiovascular center in Pahang. That's amazing. And now you're in Johor, contributing to Johor pula, yeah?
Yeah.
All right,
Yeah, thank
awesome.
you.
So one question, doc. Any regrets going into cardiology? Because
No,
you
definitely not. Because I love to do life-saving procedures. Because when I was in Kuantan, to do actually with 100% primary PCR, it means that when the patient has chest pain at 3 a.m. in the morning, I still came to the hospital, to open their blood vessel. So more or
wow.
less, I sacrificed my life actually for the Pahang people at that time.
Right. Okay, kira
Yeah.
superhero lah. In a
Maybe
way.
no, but something that you feel proud actually proud
Yes. Okay.
for yourself.
Directly.
Maybe others feel doesn't feel it. They don't
Okay.
feel it, but I feel something and I'm maybe proud of myself because this is not easy to do. Yeah, primary PCI is not easy to do. Even in our country, normally we do delayed percutaneous intervention.
All right.
Okay.
Okay. I love Jessie's comment. She's saying doctor has a good heart. Very good. Okay, Doc, why is it important that we talk about today's topic? What are you hoping the audience will take home after this episode?
Because there is a lot of misconception about the heart attack. So
Mm-hmm.
heart attack is different than heart block. I'm talking about the blockade within the blood vessel.
Okay.
Blockade within the blood vessel is two different things. Sometimes
Mm-hmm.
it won't kill you. It kills you slowly. But heart attack can kill you immediately. Sometimes within 1 hour, within 40 minutes. If you don't get a good treatment, appropriate treatment, on time treatments, you will probably
Die.
succumb, die.
Yeah. Okay. Got it. So as you're tuning in today, please know the difference between a heart block and a heart attack. One kills you
Yeah,
faster, the other one slower. At least we know.
yeah, yeah,
Both
yeah.
gets you there. Yeah, kind of thing. Not that we want to go there, right? Okay. So without further ado, let's begin. If we can have the first slide. Yeah. So we're talking about serangan jantung. Yeah. The first
Yeah.
slide. Okay.
So actually, my first slide shows it's nothing. It's about the coronary arteries. Most people actually know that coronary artery vessel here. This is your right
Mm-hmm.
artery. This is the most important one, and we call it left anterior descending. This is another vessel. We call it left circumflex. But the most important I want to show here is about here. Yeah, when you have block here and heart attack here, I can tell you 100% of not us, yeah, 100% of patients actually will die because when it block, it take 40 minutes. We have to remove the block within 40 minutes. As most of the patients, even the Western country, most of the patients die on the spot. But here, if you have block here, I think you still have time, about maybe 1 to 3 hours, 4 hours. The outcome is still good. But here, I think the most dangerous area to get heart attack. That's why sometimes you have heard that somebody on the field, footballers, instantly die on the field. You see, it's just because of the probably heart attack within this area. We call it left man stand vessel. Okay, this is okay.
Okay.
This is a
Got
bit
it.
of anatomy.
Okay.
Okay.
And this one,
So
Doc?
then I want also you all to know also whether you like it or not. We are born with fatty streak, meaning that there is already lipid, the cholesterol within our blood vessel. Since the age of 30 and onwards, this will be accumulation of fat within the blood vessel, which is eventually getting thicker and thicker. Sometime, if we are unlucky, cause heart attack. Okay, this one the cause heart blockade. Then I would death later on with heart attack. Okay.
Okay. So this is called how to
This is
pronounce it,
called
Doc?
atherosclerosis. Yeah,
Okay.
atherosclerosis because accumulation of fat within
Mm-hmm.
the blood vessel. So
Mm-hmm.
the rate actually of accumulation, it depends on the diet, genetic, yeah, and diets also because of high cholesterol diet. Our genetic also influence and the rate of accumulation of fat within the blood vessel.
Okay, we're gonna look
Okay.
at the diet later, yeah.
Yeah.
So kind of okay. So definitely 30 years
So
and above that.
yeah, from the diagram you can see, yeah, the blockage here, yeah, because of the accumulation of fat that I told you just now. You can see here. Then you can see here also 100% block here. Okay, this is 100% block. This is maybe about 80%. So this is the block within the blood vessel from
Okay,
this diagram that you have seen just now, the atherosclerosis, yeah, the previous slide, the
hmm,
how it look like inside the blood vessel.
I see. This when you say it's blocked, is the left side, right?
Yeah, this is a block. This is also a block. This is 100% block. Yeah,
Okay, got it.
total block. So I don't want to because I have a question. Yeah, this is the question that I want to ask you. Then my first question will be to the audience. Yeah, but please listen carefully. Yeah, the heart attack that kills they kill us actually. They can kill us is a slow process. Yeah, of deposition of fat within the blood vessel, which eventually getting thicker and thicker and totally occlude the blood vessel. Yeah, it's a slow process. Majority of us will answer it right. I will tell you, even some doctors also will answer it right, but the answer is
Hmm.
wrong. This is
Wow.
we call heart blockade. Meaning the coronary artery is blocked, but it is not heart attack. Heart attack actually is a process that occurs all of a sudden. And then within the 10 minutes, it will totally occlude the blood vessel. It is very rapid process, occurs total occlusion within 10 minutes. And it is not, that is closed by the fat, but it is caused by the blood clot, sudden clotting, sudden occlusion by blood clot within the blood vessel. So how it happens, I'm going to discuss with you later on. Okay?
Okay. Okay. All
So
right.
this is, you can see here, normal blood vessel. This is the atherosclerosis that I discussed with you. Remember, yeah, you can see. Then when there is a sudden tear within the blood, the epithelium, yeah, the cap that covers the atherosclerosis, just can you see a very thin cap here, which prone to rupture. Then when it exposed, when they rupture there, when this inner part exposed to the our clotting factor, especially platelet, this one, the platelet and red blood cell, when exposed to this inner part, peptidoglycan, it promotes coagulation factor, then it will cause blood clots, within the blood vessel within 10 minutes. That total then can occur that totally can occlude the blood vessel. This is heart attack. It's a sudden tear within the cap that cover the epithelium. Okay?
Okay.
Then this is very important. Then, okay, for example, like just now, for example, like here, this is my second question, yeah?
Mm-hmm.
You can see here, this patient, no block at all, The A is here, very minimal block, then a very severe block, here. So my question would be, can this A, the one that I show on my pointer, can this A get heart attack? So majority of her will answer no. They cannot get heart attack. But the answer is still yes, they can. Why? Because there will be some sudden tear within the blood vessel here. Sudden tear here, then it will expose the inner part just now, the cap that lining this epithelium, expose the inner part. When expose the inner part to the blood and cause the coagulation mechanism. It is also the same like when you have a wound, wound with the wound, then eventually you notice that your wound stop because of the blood clots occurs externally. This process blood clot occur internally because of the sudden tear, the wound inside the epithelium. I think you got it, yeah?
Yeah.
So this is very important. Yeah, this is very important concept because of the blood clot. So when we want to treat, we have to remove the blood clot quickly. So how do we remove the blood clot? So there's so many ways. Are the two ways how to get rid of the blood clots. Okay. Then the second thing very important here. For example, like just now, if you have a heart block, yeah, the process is slow. It's slow process. Eventually, slowly, totally occlude the blood vessel. Even though your blood vessel will be 100% blocked, but it won't kill you. You won't die because of that, because the process is slow. So the heart has the mechanism how to compensate with the block. The first mechanism is by growing the we call it collateral blood vessel. I will show you later on the video. And the second mechanism, we call it protective mechanism, is that by refusing to work, meaning that if the heart does not receive adequate blood supply, it refuses to work, and then it works slowly. That's why sometimes you present with fatigue, shortness of breath, exhaustion, because they don't really obey the command really to supply the blood according to the demand. They can know if I work hard, we will die. So they refuse to obey your command. You might manage your activities. Then you have shortness of breath, exhaustion, your fatigue, you become lethargic, like that. Okay? This is because I have block. But heart attack, you have no time for that. This will occur all of a sudden within 10 minutes. Okay.
Then how, doc? Because if you have only 10 minutes, then confirm lah, die lah, right?
It depends on the side of, like I told you just now, it depends on the side of the block. Yeah, if the block occurs proximal, I think the nearest to the main blood vessel, so the kata will be very, very bad. There is because it involves a lot of myocardium. But if it involves distally, I mean, at the end point there, because the area that that be occluded by the clot is minimal, so the symptom is not that bad. It depends on the side. Okay.
Okay, got it.
Okay.
So that's why it's important to know the symptoms, kind of thing. Also,
exactly.
Doc, just to share with you, when I don't know if you're moving the mouse, but we are not able to see it on the screen. So if you could describe it, would be good. Yeah.
Here.
Because
here is normal blood vessel. This is the plaque, the atherosclerosis. Yeah. But heart attack can occur within the normal vessel and also within the atherosclerosis. But bear in mind, if you have atherosclerosis, it means that the cap majority, the cap that covers the plaque is thin. It's more or less thin enough. Because if you have a thin epithelial lining, it's prone to get rupture.
I see. Okay, got it.
Yeah, okay. So this is about heart attack without a block. You can see here about 6%. Yeah, occurs. Yeah, we call it MINOCA. It's MINOCA means myocardial infarction, non-occlusive coronary artery. Myocardial infarction means heart attack. It's not occlusive, meaning that no block and the coronary artery. It occurs about 6%, especially in lady, female. But this is less likely to have high blood level of fats. Meaning that even though you have low level of fat, you still can get heart attack.
Wow. Okay. Why? Why is it?
No, because most people thought that heart attack is due to the cholesterol. This is indirect cause because cholesterol accumulation with the blood vessel, they cause thinning of the plaque. When they cause thinning of the plaque, that's cause prone to injury, to rupture. Just now.
Okay, got it.
Okay. So this is what I'm to show to you, the total occlusion here. You cannot see the flow at all. Then when we open, we suck up. As a cardiologist, we suck up the clots here. Okay, you can see, good? You can see the blood vessel. This is our job actually, basically. We have to do it on time. If you don't do it on time, this area will be dying, probably death of the myocardium can occur later on. Okay.
Okay.
Sorry.
That's okay.
So this is my third question. Yeah. So you can see, like I told you just now, even though you have no block, yeah, and then still you can get heart attack. But my question would be like this: if A, this one, and this one, get heart attack, okay, this one also you can see they have very thick occlusion, very heavy occlusion here, especially here. So if here, A here and B here, both of them get similar kind of heart attack, similar size, similar time, similar duration, if I say the mortality in here, A is higher than here, B is higher than A, the answer is wrong. Actually, the mortality is higher in here, in A. In those who has very minor disease, minor atherosclerosis, if you compare to those who have heavy atherosclerosis, mortality will be here. Right? You will be wondering, right? Why?
Yeah,
That's
why?
actually you have heard that footballers sometimes
Yes.
sudden death on the field. This one, somebody already on medication, probably they have chest pain. Actually, they are less likely to die compared to A if they get heart attack. So the reason being, that's on the next slide. The reason being, go for the okay. The reason being is like this: when you have significant occlusion, for example, here the gray area is the area involved that does not receive enough adequate blood supply. So this is the area involved. Then when there is occlusion and there is cause, we call it hypoxia, lack of oxygen. Hypoxia means lack of oxygen. It will stimulate, collateral, new blood vessel formation. You can see here. So the new blood vessel formation, Then if you get heart attack with the blood vessel already has established collateral, it means that you still can get adequate blood supply to supply the distal part of the occlusion. You got it or not? Meaning that you still can get blood supply to this area, this part, even though this part is totally occluded. You got it? That's why people who has block, they have collateral. This is our body defense mechanism. They have collateral. This collateral sometimes save their myocardium. But people without collateral, so they have no collateralized, no blood supply that can help them receive not enough blood. So it receive some blood supply. Then this will really, if they have heart attack, they are most likely to die. Because
got it.
You got it or not?
Yes. So basically, somebody with is it arteries or whatever, like B is more likely to survive because they have the collateral circulation.
Yes, exactly. Because they have the collateral.
Sense,
how the collateral grows? Because when you have, we call it hypoxia, inadequate blood supply, it will stimulate new blood vessel formation.
Because the body is
our body, we call it defense mechanism. How to protect our body, you see? Our body knows how to protect themselves.
Yeah.
Okay. We don't have to command. And you can see here also, this is collateralized, you see, blood vessel.
This is a very good diagram, yes. Okay.
You can see? Here, no, right? You can see here, collateralized already, Very, obvious, blood supply here is compared here, nothing, almost, nothing there. This we call it collateral, okay?
Okay, got it.
Okay.
This one?
Then, with that knowledge just now, this is the way we put stent. So most of us, when they have block, they want to put stent inside. This is the way. This is our stent actually mounted on a balloon. Then we will inflate the balloon and then cause, that's how we open the blood vessel. So my question would be, can stent injure the blood vessel? Yeah, the answer, the stent can injure the blood vessel.
Can.
So meaning that, putting stent, the stent can injure the blood vessel. That's why I have to provide you, when after stenting, 2 antiplatelets, blood thinning drugs to prevent blood clotting mechanism inside the blood vessel. Okay?
Okay.
Okay.
Okay. So the balloon you take out,
We
right?
take out the balloon because
Yeah.
actually this this one all it's like a monorail, you know. It works on a piece of guide wire. It's all wire inside here. This is a wire
Mm,
here. The wire
okay.
here we can take out the balloon and then like that we can push anything like as yeah. Sometimes we put we call it thromboster that can suck up the clots. We can
Mm,
suck the clot with
okay.
the thromboster. Yeah.
Okay.
Okay.
Got it. Okay.
Okay.
And
This is
this one?
again about the stent thrombosis, yeah, because of the just injury to the blood vessel. Sometimes the stent also can get occluded, yeah. Then we have as a doctor, this is one of the complication, of stenting, yeah. So
Mhm.
stent also can get occluded, but the risk always outweigh the benefit. Okay, so we have to do if the benefit is more than the risk. That's why we have to put stent on you. Okay,
Okay.
okay. This is about again the stenosis and restenosis, the efficacy and the safety that I want to highlight. That is the putting the stent does not guarantee you 100% patency for the rest of your life. Okay, there will be some mechanism that the body try to more or less heal any injury that occurs within the stent. Within the stent. Okay,
Hmm. Okay.
okay.
All right.
So I want to share to you, this is my previous experience, because I'm from Pahang. I still remember those days because I'm very, like to do this primary PCI. I have this guy, 42-year-old, diagnosed heart attack, yeah, cocaine pain, 3 hours chest pain. The problem is transfer to hospital Pekan. There's no facilities to do, to remove to suck up the clots. And then somehow, because the distance to Kuantan is very near, then they asked me whether to give anti-clotting drugs or not, or transfer immediately to Kuantan. So you have to calculate the time. At the time, they can arrive within 30 minutes to Kuantan. Then at that time, then I kata, yeah, you send quickly to us. We open almost all the vessel, because even though it's after 6 hours, we open all the clot, we remove everything of the clot. But even though we have done everything, the patient is succumb at day 3 because even though after 6 hours, it occurs at the very important blood vessel, proximal LAD, still the patient succumb at day 3. The patient actually has 5 children. Even though meaning I'm 27, even though we are very successful in doing our job, because 6 hours is because sometimes it's quite late. I will discuss it with you later on about the graph of survival graph later on. Okay.
Mhm.
Okay, that's want to tell you very important actually, if possible in Malaysia, to all the centers, yeah, is within our reach, should be within 90 minutes, yeah, if possible. So but the state of Japan is very big, and then we should think of how to deal with all the attack, the heart attack, yeah, within the state. We only have one center in Kuantan.
Okay.
Okay,
So I guess if you are a heart patient, one of the important things you need to know where is the closest
yeah.
center close to you, and within how
But
many minutes.
Western country like Germany, they already designed, as such like computer, For example, Tebrau, already. The ambulance quickly send you to the hospital Columbia Asia. You don't have to ask, because there's some agreement like this center covers by this hospital, that area covered by that
That's a
hospital.
good one.
So we should
Mhm.
have that kind of plan actually in uh,
Mhm.
in in our country. That's
Okay,
what I
awesome.
think.
Mhm.
Okay. There's again another patient, a 40-year-old Chinese. This is from Bentong. I think it is maybe a sad story. I don't know. Was given a drug that can last the clots. But by giving the drug, we hope that we can open the clots. But however, it failed. Because it failed, then they decide to send to the center adequate with percutaneous intervention that we can remove the clot, meaning that they have cardiologists, yeah. Then they send to us, even though into IJN, maybe it's closer to Bentong. The reason being, pertama, is within the state. The second is because the jam kind of thing. The people at that time, they think that possible Kuantan is the fastest, to send the patient the cardiac patient. Yeah. Then because then when the patient reach our hospital, actually it's about 2.5 hours. We open everything. All the vessels. We remove all the clot, but yet still a day 4 the person died.
I see. Okay.
Yeah, meaning that I want to tell you is something like this. If you late to get to
Help.
get your help, then this is the outcome that people might get. Okay,
Mm.
very
Okay.
important to come early. That's the message. Okay, okay,
Got it.
you okay?
Are you guys getting this? Let us know in the comment. Yeah. All right.
Okay. This is
So,
again.
mhm,
This is again about the heart attack. I got it from
mhm,
this is Google, nothing special. The very important, number one is urgent medical attention. Usually,
mhm,
recommended, especially by healthcare provider, can be dangerous, or life-threatening if untreated. Sometimes don't underestimate your chest pain.
mm,
It can be fatal. Treatable, it should be treated by the medical professional. Then, of course, definitely requires many tests, and that can last several days or week. This may be the warning sign. Commonly for occurs at the age of 60. But here I want to share you about the age.
mhm.
So I trained in Penang. When I was in Penang, I have seen most of people in Penang, they get heart attack. Normally their age is above 60. I agree with the statement. Then after when I went back to Kuantan, I only want to cater people above 60. But in Kuantan, I have seen a patient age of 19 got heart attack. 19,
Yes.
one
Why
nine.
9?
Yeah.
Why?
You know
Why
what?
are we getting
You know
younger?
what's the reason?
Yeah.
Because
Why?
I'm hope that people in Kuantan won't be angry at me, but I found that over there, the number of smokers, especially the younger age group, and this guy actually smoked at the age of 7.
7. Okay.
Yeah,
Okay.
11 years after that got heart attack. So this is an important message. I have seen enough patients that got heart attack because of the tobacco. Okay.
Okay. Okay. Got it. So
Okay.
that's what happens when you
Yeah.
smoke. Yeah. Okay. And this is
This is
also.
another cartoon. You want to say another video, another diagram to show this is the block. But because atherosclerosis, the heart attack still can occur before the block, not necessarily within the blocks. That's what I wanted to show. Yeah. So meaning that heart attack can occur anywhere along the blood vessel, as far as you have a very thin fibrous cap that cover the blood, or the thin cap that covers the epithelium.
Okay.
So very important. That's why sometimes maybe my advice is not so good, but especially those who who are at my age, I don't advise to do strenuous exercise now. But recently, I have one patient, 61-year-old, play basketball.
Mhm.
Second, collapse on the field, immediately brought to my hospital. We do resuscitation, and then already passless, already no ECG, nothing, already dead. Before coming to hospital. So then I don't know. It's maybe I don't encourage strenuous exercise for those who are the age above 60, because sometimes maybe because that exercise sudden jets, that maybe
Mm,
tear the blood vessel. I don't know. Maybe because of that. Okay.
okay. Got it. So no strenuous exercise.
For the elderly.
Okay. All
Train
right.
hard possibly possible. Okay, this is again another diagram. It is what will happen after the sudden occlusion of the blood vessel, because our heart is not ready. This is the occlusion. Okay, you see the occlusion. Then after 24 hours, you can see the black in color here is already dead. This is dead myocardium. It's already dead. It is unreplaceable. Even though you do the angiogram later on and you open the clot, this muscle already replaced by scar. It's already dead. You cannot do anything about it. Okay, but that's why very important timely action to removal of the clots on time, get treatment on time is very important message for those who are having heart attack. Heart attack is not like do you do stress test positive like that. Stress test positive normally it is heart block because it's thick and weight. That one because the atherosclerosis just now. Heart attack majority caused by blood clots.
Blood clots.
Okay.
Okay. Got it.
Okay.
This
This
one.
is this is the survival curve that I want to show to you. If you come to the hospital within 1 hour after the attack of after heart attack, yeah, the survival of the myocardium close to 100%. Meaning that you can your myocardium can be normal 100% of the attacks, yeah. But if you come to the center within 3 hours or 4 hours, can you see only 20% of the myocardium survive? Then you can see here, if after 24 hours, almost nothing left for us to salvage.
Mm.
Okay. This
Okay.
is this is a slide is very important to tell that very important to come to the hospital early, especially within first 1 hour of chest pain, of the symptom. Not necessarily you have symptom chest pain, sometimes it present with other symptoms. Okay?
Hmm. All right.
Okay.
So chest panger, get to the hospital within 1 hour. I think better
Yeah.
safe than sorry,
I,
right?
I think maybe in our country we need something like chest pain receptionist run by the paramedic. So when they call, for example, 000, then it's in the Western country, in Australia also, they have the number. You call them, oh, they will answer, yes, what can I do for you, sir? I'm here. And then this
Uh-huh.
sort of questionnaire, A, B,
Mhm.
C, D, B, D. Then the paramedic will say, sir, you are having heart attack. Stay there. I'm coming to you. This,
Wow.
wow, it
Okay.
should be like that, you know. And
Yeah.
then
So,
the ambulance will
like,
go direct to the
yeah. So
to
Jesse's saying time is very crucial. Every second counts. Definitely. Yeah. So
yeah.
this is pathogenesis. Is that how you
Yeah,
pronounce
this again, I will repeat again, the tear within the blood vessel you can see here. And then when it tear, this is the blood clots. When the occlusion is not 100%, we call it unstable angina or non-STEMI, depend on the speed of the occlusion. If the blood clot totally occlude the blood vessel, then we call it STEMI.
it?
Myocardium, we call it ST elevation myocardium infarction. Then this will cause death to the myocardium if it's totally occlude the blood vessel.
Okay.
Okay.
Got it.
So then you be pondering, maybe you'll be asking yourself why the
The
plug,
plaque.
the lining can get ruptured. It is because the lining, you see, the fibrous cat that cover the atherosclerosis. Can you see here? The fibrous cat here is thin. This one is very thick. Yeah, you can
Mm-hmm.
see the thin fibrous cat prone to get ruptured compared to the thick one. But
Mm,
luckily, majority of us has a thick fibrous cat. If not, then most of us will get heart attack, but the incidence will be very high.
I see. Okay.
Okay.
Okay. Got it. Next slide.
Okay. So this is again that I want to show you plaque rupture. This is not totally 100% occlusion. This is just small occlusion. This one, because the speed of the occlusion here cause chest pain. Depending on the speed, they will cause present with symptoms. And then if to cause total occlusion, the symptom will be more severe compared than the minor one, the lesser one. Okay?
Okay.
So again, is total occlusion of the blood clots.
Okay.
Okay.
Got it.
So again, this is I want to highlight because in the blood vessel there is so many inflammatory process that occurs that's influence the fibrous cat that lining the blood vessel, whether it's become thick or thin. It depends on the inflammation process within the blood vessel. This one also actually being influenced by your tobacco, your cholesterol, your lifestyle, basically, whether you are
I see.
diabetic or not. Okay.
Sounds good.
This is again, sorry, I repeat the total occlusion just now, totally occlude, but not necessarily you die because of this occlusion, because our body has defense mechanism. But if it is because of clot, sudden occlusion, again, I want to emphasize, it will cause fatal. You can die because of that incident. That's the occlusion. Okay.
Okay. All right.
He said
And
again, how common is a coronary artery disease? Like Nina discussed just now, the first statement, coronary artery disease or heart attack is number one killer in Malaysia. Again, okay. So in this slide also it shows that heart disease still number one killer and the number one disease prevalence in Malaysia. Okay.
Okay, got it.
Follow. Okay.
So it's different year. And this one, Doc?
Yeah, this is how does coronary artery disease occur. Narrowing of blood vessel, depend on the speed, reduce blood flow, impact oxygenation, and that cause symptom. So if it is due to the block, because it occurred slowly, because of atherosclerosis, your symptoms sometimes gradually increasing in severity. Initially, maybe a month, and then it occurs within 1 or 2 minutes. Slowly become 2, 3 minutes, 4 minutes. Next month become 10 minutes like that. Then when you go to see your cardiologist and they do the stress test, it's going to be positive. But in the case of heart attack, sudden occlusion, normally, they cause 100% impairment of the oxygen. This later on cause very severe chest pain, and sometimes you have loss of consciousness. It can also sweating like that, fatigue, and then it can cause heart failures. Okay, immediately after the incident.
Immediate after the incident. Yeah. Okay.
This is again the process that I mentioned to you just now. We call it atherosclerosis. It does not only occurs in the heart, it also occurs in the brain, which cause stroke. Okay. When it occurs within the renal, within our kidneys, it causes renal failure. But in kidneys, because kidney has, I think, millions of blood vessels, it means it takes time, for you to notice that you have kidney problem. That's why many people has a wrong concept. They think that sometimes drug, when they are diabetic, they always blame the drug that cause renal failure. But in actual fact, it's because of the occlusion of the blood vessel occurs slowly, one by one, millions of capillaries, millions of the arteries within the kidney, then, to get them a significant occlusion and then cause symptom, means renal failure. It takes time as compared to when you have block within your brain and also within your heart. You can get the immediate symptom. Okay?
Right. Okay.
I think you got it, Nina?
Yes,
okay.
yes. Thank you. I do have a question. Like, if your arteries are blocked in the different areas, do you guys look into that, or the other doctors will look into that?
So we have also peripheral interventionalists, sometimes, for example, stroke, we have expert in stroke. They can remove the clot within the blood vessel. I have heard that one of the center in Klang Valley, I think it's not that I'm promoting, I'm so sorry, that UPN actually is doing the emergency removal of the clots within the brain. Yeah, that's a center that I can remember. And maybe from the Asia, if not off, and if we have a peripheral interventionalist, normally a radiologist that can remove the clots, and then that's good. Okay, I believe we have. Okay. Okay. So this is again, how do they diagnose? This is coronary artery disease. The difference between coronary artery disease and heart attack is the symptom is more severe. It might occur all of a sudden. Those who have coronary artery disease, because of atherosclerosis, the symptom normally occur gradually, slowly. Sometimes they present with tiredness, sometimes they present with shortness of breath or exhaustion, slowly. And then they go to see their doctor. The doctor do some tests, stress test, for example, like that, and they got it positive, and they send to angiogram. This is most likely coronary artery disease. But for the heart block, the symptom is normally severe. But bear in mind, some people they have a very high threshold of pain. So sometimes, even though I have one patient recently, still can smile, even though he got heart attack. I could, how come, you have very severe block, No, I don't feel it, because he is diabetic. So most of diabetic patients, sometimes they don't feel the chest pains, but they present with fatigue, shortness of breath, exhaustion, like that. Okay? Okay.
So I'm going to put Sakina's question here, because her question is, what is the most accurate method to detect heart problems, stress tests, and all that? So since we're talking about it here, we can answer it here as well. Yeah?
Yeah, the problem is like this. what is the most it's a heart problem? This is very general question, heart problem. So this is mainly because of we call it coronary artery disease. Even the
Mm-hmm.
stress test is not accurate, echo is not correct. Calcium, heart scan. The issue is like this. Most of us think that they want to diagnose block. If I have block, it's equal to heart attack. If I don't have heart block, they do the coronary angiogram, and I'm not getting heart attack. This is wrong. Even though your angiogram is normal, you still can get heart attack. So if you are talking about heart attack, the most important, we need a good system that you can go to get the immediate treatment nearby. So if possible, we have many centers in Malaysia that we can go directly because we don't know who can get heart attack. So if you're talking about coronary artery disease, normally
Yes.
preliminary we do the bystander. Normally we do stress test, either stress echo, stress dopamine. We have even MRI, stress echo, radionuclear stress echo. Then when we detect some reduction in oxygenation of the heart, then we proceed to angiogram. This is a standard way of managing those with coronary artery disease. Okay.
Got it. That sounds awesome. I think that question's answered. Okay, now angina, right?
This is you're talking about chest pain just now. Angina is about chest pain, it's cardiac chest pain.
Mm-hmm.
So in patient with heart attack or block, coronary artery disease, the symptom almost similar, but the severity is different. So they can present with chest pain, especially crushing over the central chest, about 5% of right chest, majority actually on the left chest. Yeah. Then it can radiate to the jaw, sometimes can the stomach, sometimes to the can radiate the finger. The patient have the kind of feeling sick, exhaustion, sort of rest on exertion at rest also, unexplained sweating, dizziness, lightheadedness, weakness, vomiting, or restless. But the more important prevention is you must get immediate help to the nearest center if you think it is heart attack, because the complication can be fatal, because you might get heart attack, sudden cardiac death, or fainting. Okay.
Right. Okay. So those are the symptoms to be aware of. Yeah.
Okay. Then sometimes you don't have symptoms, but still you can have fatigue, exhaustion like that, like especially those who are diabetes, they don't have chest pain.
Mm-hmm. Okay.
Okay.
Next slide. This is chest
Of
X-ray.
course, preliminarily, sometimes we do chest X-ray to look whether the heart is big or not. This is just standard test normally we do. The echocardiogram sometimes we also do in an emergency, because echocardiogram will tell you which X-ray is not moving when they have heart attack. So normally they have very good pumping mechanism. You can see the movement of the cardiac. If that area is not moving, most likely the X-ray does not receive adequate blood supply. Then we know very well. Then we correlate with the ECG, the symptom, everything. Then we can say that this guy probably have heart attack.
I see.
Then again, like we mentioned just now, stress test definitely on the treadmill. So basically, stress test is like this. So simple. The analogy is like this. Now, say where you have a bungalow, 6 occupants in the bungalow, and you do dishing, washing, bathing, no problem. It means the water supply is good, right? So now during the Chinese New Year coming, then you invite about 100 people to your house. Then again, bathing, cooking, dishing, everything, it's okay, no problem. It means that the water supply is good. So stress test also like that. Initially, we stress you at rest, we check the ECG. If no ECG changes, it means at rest, normal. Then now we stress you up to a certain level. We'll ask you to run on the treadmill. Then again, we do the CG on you. There's no changes. It means the flow is good. Just like just now, 6 people and 100 people that we test on the water supply. But maybe people will be asking, you don't see the blood vessel. But this is the analogy, the inference. It means that we stress up to certain limit. There's no change. It means your heart is okay.
Okay. That's awesome. So that's stress test, right? Okay, we need to move quickly because I need to.
This is about the angiogram. When you do the angiogram, you can see the blood vessel very well. You can see here your blood vessel. We put that. Okay, we can move to the next slide. So many slides to show. I think it is another angiogram. Which is, yeah. Okay. This is again. You remember when we do the angiogram, we put the catheter, yeah, from your hand or maybe your groin, that
Mm-hmm.
right to the blood vessel. Then we push the dye inside, and then the dye will outline your blood vessels. Then we, if want to do intervention, we push the wire straight in. The wire acts like a monorail. With that, like I told you, we push the balloon and the stand. This is how the procedure actually. This is again, you can see the way that we do it. This is the stand that mounts on the balloon. We inflate the balloon,
Mm-hmm.
and the stand now actually covers, open the blood vessel. Okay,
Okay.
this is again the stand. Sometimes we just balloon. Say,
Mm-hmm.
okay, you can see that. Okay, next slide. This is again, I will show you the stand. Yeah, you can
That's
see
what
the
it looks like. Yeah.
the blood vessel on the mount on balloons. Then we inflate the
Wow.
balloon, the
Okay.
stent will be open. Okay. Now this again, the stent. Can you see? When you open, it's unmalleable and it does not collapse. It's a
Okay.
design as such that the material sometimes titanium kind of thing.
Okay.
Okay. This is say the blood vessel, and we open, see nicely open. Yep.
Okay.
So okay, and then next slide. Okay. So I want to show about coronary bypass. That's the bypass, you know. You can see the graph here. So how does they do the bypass? Yeah, yeah, next slide. So,
Hang on. Huh? Okay.
wow.
Risk.
Oh, yeah. We put, we missed the slide just now. But I'm talking about the risk. This is the graph, yeah. Just now, the graph, they bypass they say the block
Oh,
here. So they take a graph, they join from the big vessel to the distal part here. They bypass the block area here. Okay, that is bypass surgery.
okay.
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 So
Now risk
this is
factor.
very important. Very quickly, I will discuss about risk factor because this is very important for you to modify your risk factor. Because if you modify your risk factor, you reduce the rate of atherosclerosis. You improve the cap that covers the plaque. So bear in mind, actually, risk factor actually divided into modifiable and non-modifiable. The next slide. So this is not modifiable age, especially age young, like me, like my age. Oh, yeah, I'm prone to get heart attack, sex, especially male, families of heart disease, race, especially Indians more than Malay and more than Chinese.
Wow.
Okay,
Indians highest risk. Okay. Is
yeah.
there a reason why?
Maybe Indian, the Malay, they say maybe food that we eat, maybe genetically. I don't know. Any genetic study has been done. I'm not sure. That's again,
Okay.
premature CND. This is a family history, inherited with other risks, and then patient closure. Yeah, identification patient for the cause assessment. We have to assess the patient. Okay.
Okay.
So this is modified, but normally doctors say when you come to my clinic or a cardiologist clinic, they try to modify your risk, especially those who have high cholesterol, smoking, high blood pressure, diabetes, obesity, sedentary lifestyle, and stress. You know why? Because this will modify your atherosclerosis. They will modify also your cap that aligns, that covers your plaque, that reduces the incidence of heart attack. Yeah,
Okay. Got it.
indeed.
So- All
Okay.
right, Doc. Last question then, because we're at the end of the slide already. So, Doc, so now that we know all this, at the end of the day, what do you want people to take home? If
But
there's one, yeah,
very important, yeah, important message is there's a misconception about heart attack. They only think that if you have block, then only you have heart attack. That's wrong. The most important is you have to improve your cap that covers the plaque. You have to modify atherosclerosis by practicing healthy lifestyle.
healthy lifestyle that includes food as well as exercise.
Exercise, good
Yeah.
food, no diabetes, yeah, no cholesterol. If possible, no cholesterol, low bad cholesterol, no hypertension, no stress. Is that possible nowadays?
Okay. Not possible. Okay. In terms of food, what kind of food, Doc? Any particular diet that you can suggest?
Of course, you try to reduce, fats,
Meat.
fat-rich
Right.
foods,
Uh-huh.
definitely, yeah. Veggie is good also. Yeah,
Okay.
yeah, and then
All right.
protein, less fat.
Protein and healthy food, basically. Okay.
Yeah, yeah,
Doc,
yeah.
let's go into the Q&A, yeah, before we go into the quiz. How does blood clot occur? Jesse's question is, how does the blood clot occur in the blood vessels?
Blood clots occurs when there is any wound or any wound inside or outside the blood vessel. You know why? Because the inner part of our blood, yeah, our blood vessel, there we have three layers. The inner part contains some matrix. When exposed to the platelet, it trigger blood clots, whether it's inside or outside. What is the purpose of blood clot? It is to seal off the wound. So but if the blood clot occur overwhelming, this will cause total occlusion, sometimes occlude the whole blood vessel.
Okay.
Okay, but outside, because of the blood loss, initially blood loss clot, you can see outside. Sometimes you can wash like that, easy for you to control blood clots, but inside you cannot control.
Okay.
Okay.
Star Sugar has a question. May I inquire about the duration of aspirin tablets for cardiovascular circulation? I
The
think you
issue
will.
will be like the aspirin. Some people, whether they want to take regularly. Yeah, for example, like how about people without any risk factor? Does aspirin prevent heart attack? So study shows that if you take aspirin, then you are normal. You don't have any risk factor, no heart attack, no chest pain. It does not prevent actually heart attack, because if compare to those who are normal, compare than those who are having coronary artery disease. Meaning that if you are normal, if you take aspirin, it does not prevent, get you better, better prognosis, better outcome than people with heart disease. So the duration of aspirin, actually we call it antiplatelet. If you are having coronary artery disease, the duration of antiplatelet, so single antiplatelet, can be lifelong for
Wow.
the rest
Okay.
of your life.
Okay.
Okay.
Next question is from Sakina. We spoke about this a lot, but let's just send the message straight. Is heart failure the same as heart attack? Good question,
Heart
actually.
failure is when your heart cannot pump adequate blood supply adequately to the demand. Meaning the exercise, you have to pump more blood. At
Mm-hmm.
rest, you pump less. But anything that disturb, and I think anything that influence the mechanism, the pumping mechanism, can cause heart failure. For example, like if you have your blood vessel get blocked, definitely reduce oxygen to the heart, then the heart cannot pump better, cannot pump good, they cannot pump appropriately, they cannot pump adequate blood supply, then you get heart failure. So heart failure is the outcome of the heart attack. It's the outcome of the heart
Mm.
disease. It's not a disease by itself. It's the outcome of many diseases. Hypertension can cause heart failure. Sometimes failed valve also can cause heart failure.
Okay, thank
Okay.
you. That clarifies a lot of things. Judy Shock's question is, what are the treatments if one is diagnosed? If you're diagnosed with heart attack, and then I suppose with coronary artery disease.
So if
What would,
you actually get heart block, the heart attack, the most important is to get the clot removed. This is very important. How
mm,
to remove the clot? In a center without cardiologist, sometimes the physician they give a medicine, to lyse the clot. Okay. Then if you go to a center with cardiologist, we can put, for example, like just now, we can suck up the clot. We put a wire in and then we suck up the clot immediately. Okay. This is the most immediate action should be done when someone get heart attack. Of course,
okay.
definitely after that you put stenting, you have to put antiplatelet later on, you have to
That one
prevent.
long term lah.
Yeah, yeah,
Okay, got it. And I suppose it's the same with coronary artery
yeah,
disease.
same. Yeah.
Okay, got it. All right.
Okay.
Cecilia's question is, how long does it take to resuscitate after cardiac arrest?
45 minutes normally. We try
Oh,
45.
45 minutes. Okay, got it.
Yeah.
Okay, so I think what we'll do now is we're going to go to quiz, and then we'll go back to Q&A. So are you ready? Let me know in the comments section. Doc, are you ready? Okay.
Okay.
So it is quiz time, and as mentioned in the earlier part of the show, we've got some exciting gifts up for grabs. So what do you need to do in order to win? First, you got to be sure to share this video out at least 3 times, and remember to set the share post to public so that everyone can see. And then you got to answer 3 questions that will be showing on screen in a single line, single comment, and you are on your way to win the prizes. So let me repeat: first, share this video out 3 times, and remember to set the share post to public so everyone can see, and then answer 3 questions we're going to show on the screen. Please be sure to answer them in a single line, and we will select the winner based on the correct answers and shared posts. So if you are ready, let's take a look at the questions. Question number 1. Heart attack can happen without a block. Heart attack can happen without a block. Is it true or false? Coronary heart disease is the most common cause of death in Malaysia. True or false? Coronary heart disease is the most common cause of death in Malaysia. True or false? Coronary angioplasty is a procedure to open clogged blood vessels of the heart. True or false? Coronary angioplasty is a procedure to open clogged blood vessels of the heart. True or false? So while we are waiting to hear who our winners are, let's go back to the Q&A. Okay. All right. Question that we spoke about just now. Cecilia is asking, can people with heart disease do cardio exercise?
Oh, definitely can. We already opened the blood vessel. We
Okay, definitely
already.
can, but
Yeah.
with make sure you don't overdo it, right?
No, I think elderly lah. Elderly don't overdo.
Elderly only.
Train
Okay.
hard. Yeah, is possible.
Okay, got
Yeah.
it. Thank you for that clarification and that question. So Jesse's question is: besides the blood vessels in the heart and brain, can clots, cholesterol accumulation occur anywhere in the body? I think you answered that. It can. And will it be fatal if not treated?
No, it depends on the so many factors. Even though, for example, like you have a blood clot within the blood supply to the fingers, that's why sometimes we have to remove so they can cause gangrene. We call it, to the finger.
Okay.
So if no collateral, like we discussed just now, meaning that no extra support blood vessel, they can cause problem to that part. Actually, single vessel occlusion, yes, it can cause problem, but majority of us, I'm talking about other area in the body, they have many vessels that supply one area. But brain and heart, for example, like especially brain, they are very precise because each area control each task. For example, like one room this task, one room this task. So if you have clock when this is one vessel, sometimes you have probably lacking of the task. You understand, because one room. So it's very important brain, even though block one vessel can cause problems as well. Okay, it depends on the side.
All
Okay.
right. Next question is from Prabhavati Sudesh Kumar. For triple vessel disease, can stenting be done for all 3?
Okay, definitely can. I love it. So if we can do it, no problem. But
Okay.
we have to go by with evidence. If the triple vessel disease better for bypass surgery, we offer surgery first. Then if the patient refuses the surgery, then probably we can offer stenting definitely. We can, even not 3, 4, 5 vessels, we still can open, no problem.
Okay. Got it. Okay. And the last question that we have comes from Jessie Liu. Does autoimmune condition patient have a higher risk of coronary artery disease?
No, because autoimmune, they're very big subject. But it's depend on the type of autoimmune. Sometimes some disease autoimmune that occurs to the blood vessel, yes, they have high risk of CAD, for example, Takayasu, something like that. That can cause high risk for heart attack. But even like SLE also, they can involve the blood vessel, also autoimmune. But most of the sometimes the complication may be because the drug also can cause problem for high risk of coronary artery disease.
Okay, got it. Thank you, Doc. So I guess that means it depends. Yeah. Okay. So we have. Thank you, Doc, for all the Q&A. That brings us to the end of the Q&A because we have our winners already. Yeah, that's right. We have our winners. But before we announce who our winners are, let's find out what the correct answers to the quiz questions are. So, Doc, you're going to help me by reading the correct answers. Okay. So the
Yeah.
first question is: heart attack can happen without a block. True or false, Doc?
True.
Okay. Coronary heart disease is the most common cause of death in Malaysia. True or false?
True.
True, we said it so many times. Coronary angioplasty is a procedure to open clogged blood vessels of the heart. True or false, doc?
True, true.
All right, so the answer is true, true, true. And our winners are Coke Infi. I suppose you drink a lot of Coke. Fat Yo Yo and Ella Joy. Congratulations to all our winners. So that's Coke Infi, Fat Yo Yo, and Ella Joy. Happening names, I have to say. So congratulations to all our winners. We will be contacting you after this within a day to get your details. So be sure to check your Facebook Messenger inbox. All right. Doc, thank you so much for today. It was so
Thank
informative, and I'm reading so many comments here. They're saying thank you so much. Very, very informative. And Mimang Doc is the best. Mimang legend, according to some of the
you.
comments. So thank you so much, Doc. We've learned so much. So a round of applause for Doc. And I guess that's all for today. So thank you so much. We hope you learned a thing or two. And if you know someone where this video is going to make a difference to, please be sure to tag them or share with them. You never know who you're going to save. You're going to make a difference to. All right. In the meantime, do give us a lot of likes and love while you're at it. Thank you again. Till then, take care of yourself and each other, because Doc has got to go and save another life today, right, Doc? And we will see you in the next episode. Thank you so much.
Thank you.
Bye.
Okay. Okay, good. Okay.